The first section of this lecture is about the ankle joint scanning and injection. When we talk about ankle joint, there's two ankle joints. One is the tibiotalar joint or talocrural joint, and the second one is the subtalar joint. Now, this is the talocrural joint or the tibia-talar joint between the tibia and the talus. So this is the joint line here. And the approach of this is mainly on the middle side is where you can see the fat pad in a moment. So this is a joint line, and one of the key landmark is the tibialis anterior. This is very, very important because the landmark guided technique that have been practiced by orthopedic surgeon is to first feel the tibialis anterior tendon, a very prominent tendon, and then to put the needle on the middle side into the joint line there. We are using similar principle, but we use ultrasound and see the fat pad. All right. Here is when you are seeing the tibialis anterior tendon, you put the ultrasound probe there, and you can put the needle out of plane on the middle side of the tibialis anterior and go in to the joint. So your needle can be actually hitting the talus bone, and then you just move the needle more caudally and until you slip inside. Or in case you see a needle jiggle and then you hit on the tibia side, you move the needle caudally and go into the recess. All right, so this is actually the key. And your needle needs to be deep to the fat pad because a lot of time when you are injecting, you put the needle either on talus and tibia in this location here, you're injecting the fat pad. It may be okay if you use a high volume with a steroid, you may spread into the joint. But when you're using a small volume, like you're using viscose supplement, this can cause some irritation. So your needle ideally have to be inside the joint, deep to the recess, deep to the fat pad. So this is a video to show you here. So I use the out-of-plane technique. One of the key is to see the tibialis anterior tendon, and you put the needle there. So this actually is the tibialis anterior tendon fat pad, and you can see my needle out of plane. And actually, so one of the things is I need to slip all the way inside. And when you are successful, when you inject, you raise the fat pad up just like this. You can see it here, and that is a successful injection. This is just to show you after you inject. Sometimes I inject contrast to my fellow so that my fellows know is actually very accurate. We can see the contrast in the tibiotalar joint there. Compared with the landmark guided technique, ultrasound is foolproof. It's 100% you are inside the joint. It has been well validated. It's a very, very successful technique. Subtalar joint. Subtalar joint is the joint between the talus and the calcaneum. So it's subtalar, means actually deep to the talus bone between the talus and the calcaneum. There are three approaches. You can do medial, posterior, or lateral. One of the technique I like is actually the lateral technique. So this actually is on the lateral side. You can see here the calcaneum form a kind of a V shape here. This anterior, this posterior, and here there is a structure that is a deep cave, almost like a cave. If you actually feel your lateral aspect of the ankle, you feel there's a cave there. That is sinus tarsi. It's just a deep hole there. And that is actually one thing that approximately lets you know you're close to the joint. So, but we are not actually putting the needle into the cave, into the sinus tarsi. We are putting this in the posterior part of the subtalar joint. How? I'm going to show you this technique is the lateral aspect, the lateral approach for the posterior subtalar joint. So what is the sonal anatomy? I think that one of the key things is, first of all, position. You put a towel there so that you can invert the ankle, so that exaggerate the sinus tarsi there. Now this is a sinus tarsi. You put an ultrasound probe right over, just anterior to the lateral malleolus. You find the sinus tarsi there. How does it look like? If you actually look at this, it's a big cave there. It's a big space between the calcaneum here and the talus above. It's just a big depression there. Now, this is not the target, but it's the initial scanning because you can recognize the sinus tarsi so easily. But the next thing is to sweep the posterior to the posterior part of the subtalar joint. When you actually do this, you will find a joint. But that's just here I want to show you. There is a few structure on the calcaneal side. There's a peroneus tendon and also the sulnar nerve. So usually when you aim at the junction between the calcaneus and talar, you don't touch those tendons. But be careful not to go too far, go inferior to the calcaneus. All right, so when I say sweep posteriorly, it means actually you see there's a calcaneum, there's a talar. When you sweep, what you can see is the joint gap, there's a space between the talus and the calcaneum will become narrower and narrower, and now you can actually go to the subtalar joint. And this actually is where you want to be. So this is actually, again, to summarize, you start with the sinus tarsi and sweep posteriorly to the posterior subtalar joint there. And here, be careful when you put the needle, don't go too inferior because you will actually catch the peroneus brevis and longus tendon, even the sulnar nerve there. So you just want to make sure that you don't touch this part. And when you sweep, you can see the talus and the calcaneum form a very tight space. That is a subtalar joint. Okay, the injection is once you establish, you do our plane, and what you do is actually a little bit of jiggling. Again, do the same thing. When you are actually into the area, here you go. So you make sure you slip the needle into your joint and you raise the fat pad because there's a bit of fat there. So you don't want to be just too superficial at the joint entrance. You want to be a little bit deeper so that when you inject, you can raise the fat pad up, and here is you feel the joint there. Again, sometimes I use contrast to show the fellow. The subtalar joint, when you inject contrast, is basically foolproof. It's actually 100% in ultrasound, but landmark guided, actually the technique can be quite different because it's a very tight joint. You can be outside. All right, this is actually so much I want to talk about the ankle joint injection. Thank you very much.